I'm Kenny Hsu, and this is Season 2 of the Inconvenient Minority Podcast. In this part 1 of this 2-part opener, I'll be talking about UNC, the University of North Carolina's DEI programs, its consequences on its employees and students, and how we were able to push back on it and successfully challenge its programs. Now, I wanted to start off with a question, a very simple question. What is diversity, equity, and inclusion, aka DEI? You hear this word DEI and this acronym used in a variety of settings today, from the school system to diversity programs in the corporate sphere to allegations about racism in America and the need for DEI to ideas of implicit and unconscious bias, the idea that we all have certain biases specifically against Black Americans. Let me define for you what I believe are the most accurate assessments of what each of these terms, diversity, equity, and inclusion, actually mean according to the people who propagate its agenda. Diversity is the desire to increase the representation of minority groups in America in institutions. This includes Black Americans, LGBT Americans, and religious minorities like Muslims and Jews. Equity is the desire for these groups to have equal outcomes as so-called privileged groups like white Americans, Christians, and men. Equity says that marginalized groups should not only be present, but they should have equal success rates as these other groups. Inclusion is the desire to make these marginalized groups feel comfortable. Sometimes inclusion can go too far, especially when it tramples over other people's rights to say what they believe, and also the equal treatment of other people. Together, these three terms, diversity, equity, and inclusion, are referred to as DEI. These three values are championed across the world, whether you value them or not. Western governments, corporations, and universities promote them as core values. Yet all three, diversity, equity, and inclusion, have one thing in common. Did you notice it? That's right, immutable characteristics. Each of these core concepts are focused around so-called marginalized minority groups. That means that you have to define who is marginalized and who is a minority. According to DEI, your level of marginalization is dependent upon where you are on the intersectional scale. The intersectional scale is the idea that Black Americans are the most oppressed, followed by other Americans, gays, Latinos, Asians, in some circles, are just as oppressive as whites. They are white adjacent. If you want to know more about intersectionality, I encourage you to look it up. But here, in this podcast, I'm going to be talking about how DEI programs are implemented. But before I get into it, I want to talk to you guys about my new book. It's called School of Woke, and it comes out August 1st. It's about how critical race theory has entered our school system and its devastating effects on children. School of Woke will be available August 1st, and it directly tackles the economy of victimhood that supports the indoctrination of children into race and gender ideology, often through the lens of DEI departments. All right, so let's get back to it. Let's get back to UNC, the University of North Carolina. North Carolina, one of the nation's most beautiful states, a state that I proudly call home, a conservative state, a red legislature, beaches, mountains, beautiful people, amazing culture. University of North Carolina is the bedrock of the North Carolina machine and the economy. It is also one of the most prestigious schools in the entire nation, repeatedly called a public IV. This public IV has recently decided to allow its medical school to turn, however, in a dangerous direction. The DEI department in the School of Medicine at University of North Carolina, where I live, has gone fully woke, or had gone fully woke. DEI was able to worm its way into critical fields like surgery. It has made healthcare in North Carolina more about what race and gender are you, or gender identified you are, rather than about the most important thing about healthcare, merit. How did this happen? In July 2020, we all know what happened. George Floyd was killed. Some call it a murder. The world went on fire about these issues, and UNC was no exception. They created a social justice task force to recommended changes to the quote-unquote School of Medicine environment, curriculum, and faculty based on DEI principles, led by their DEI task force, their DEI director and dean, Emmanuel Nathan Thomas. How did he get there in the first place? Even before George Floyd, remember, racial tensions were high. A lot of that was because critical race theory had entered the mainstream discourse, and a lot of it was because people wanted to find a way to own Trump and cast him as a white supremacist. So they made DEI departments in schools and companies all over trying to say that their institution was racist. Because if you say your institution is racist, you justify the DEI department, because DEI claims to solve racism. It claims to be anti-racist. But now let's look at this task force that the UNC School of Medicine created to report these recommended changes. In this task force, and I'm just going down this task force to you, there's a glossary that's incredibly wordy, even for words with existing dictionary definitions. But I want to tell you about some notable definitions that are in UNC School of Medicine's task force to integrate social justice in the curriculum. The first one is anti-racist. It defines anti-racist as a state of mind that requires deliberate action regardless of your own race. Action to do what? To combat racism. But notice how whenever you talk to a leftist anti-racist, they never tell you what they're for. They only tell you what they're against. And the reason why is because they don't want to tell you what they're for. They're not for what I believe to be anti-racism, which is color blindness, which is treating everybody according to their abilities, not according to their skin color. They're actually not for that. They're for equity. Equity is about treating people according to their skin color. That is prioritizing the treatment of the most marginalized groups, quote unquote marginalized, the first. That's why the city of Oakland rolled out a vaccine. And when it rolled out a vaccine for the COVID-19 pandemic, it prioritized Black people first. That was despite the fact that Asians were just as likely to get COVID at a certain age as Black people there. That's what equity is. It's about handing things out based on your position in the intersectionality scale. Another definition that UNC School of Medicine used was this term hidden curriculum. It consists of the unspoken, unwritten, or implicit messages communicated to students, often unintentionally. What is this hidden curriculum in the School of Medicine? What is the hidden curriculum you're learning when you're learning about how to treat a kidney? Well, evidently, according to the DEI task force, it's a racist curriculum. Students, even though they were ostensibly learning about how to treat kidneys, were really learning white supremacy. Why? Because there were not enough Black people featured on the covers of these textbooks. That's why. They were really ingraining white supremacy. This is a very conspiratorial. DEI is a very conspiratorial outlook. No institution right now claims to be racist, except for maybe the KKK, but certainly not the UNC School of Medicine. But the point of DEI is to generate a narrative that even though you don't claim you're racist, you're still racist. So it goes into increasingly conspiratorial lengths to prove that point. A third definition that the School of Medicine uses is this definition called implicit bias. Implicit bias means activated involuntarily and without an individual's awareness or intentional control, not available through introspection. That's what implicit is, involuntary. basically UNC is asserting, their DEI program is asserting that even though you don't consciously admit prejudice, you are prejudiced. Now, I want to be clear. Prejudice is a biblical term. We know people have prejudice. We know people, and you don't have to be religious to understand that people have prejudice, okay? But unconscious bias goes deeper. Remember that whole controversy a little while back when it said that black people can't be racist against whites because they don't have the power? It's a similar thing with unconscious bias. Unconscious bias means you can only be racist, secretly racist against black people. You can't be racist against white people. So we never talk about the unconscious bias of black people against whites, even though it's very consciously manifested in social surveys. Social surveys have proven, for example, that on average, black people view themselves, black people view black people very warmly. They have a very high self-evaluation of their group, of their skin color group, and a very low self-evaluation of white people. And they also have a low evaluation of Asian people. So that is conscious bias right there. That is bias that is manifested in social surveys. That is evidence. That is measurable. Unconscious, in the meantime, however, if you look at white people's social surveys, you see that white people manifest no difference in warmth based on stated answers to questions between black people and white people. Zero difference. In fact, white liberals seem to manifest a slightly lower warmth towards their own white people compared to black people. So why are we saying that unconscious bias is about white against black racism when the conscious manifestations in the evidence points to black against white racism? But that's not the point. The point is cast the white supremacy narrative. So there we got it. Right in the definitions in itself, the task force points to a narrative that the medical school and the hospital system in North Carolina is systematically racist. That is, racism is normal, and it is normalized within the institution. That is critical race theory. Once you read my book, School of Woke, you will see how critical race theory has wormed its way throughout the educational institutions and now has made its way over to healthcare. But critical race theory fundamentally is the idea that disparities in America are due to racism. Disparities in America are due to racism. Remember that. Right now, I'm training you to understand the definitions, to understand the language. Now we go to the UNC School of Medicine's recommendations that have been implemented by the School of Medicine in its policy based on my investigation of UNC School of Medicine conducted by my nonprofit, Color Us United, which you can visit at colorusunited.org. It listed 82 different recommendations to solve this problem of white racism in the School of Medicine, a problem that has no evidence that they show exists, but nevertheless they acknowledge as a universal truth. But here's recommendation 1.7, so the seventh recommendation. Improve accountability. Recommendation 1.7 says, improve accountability measures for students, faculty, staff, and residents that contribute to a hidden curriculum that does not support School of Medicine values. Remember, hidden curriculum. That's the idea that merely by the fact that there aren't black people represented in these images, that the hidden curriculum is that you're internalizing white supremacy or a white structure. Hegemony is what Herbert Marcuse, the communist scholar, who was very influential in US academic circles in the 50s and 60s, wrote. Now, since hidden curriculum and implicit bias are both very ambiguous terms, it gives the DEI task force power to control what this recommendation suggests. People should be held accountable for messages against DEI, even if those messages are unwritten, unspoken, or unintentional. Sounds pretty accusatory, doesn't it? You don't even have to write, speak, or intend racism. You can be prosecuted for it anyway. That is cultural revolution stuff, guys. That is Maoist mind guard stuff. That was what Chairman Mao did in his Cultural Revolution. He implemented Red Guards to implement the proletarian revolution, and anybody who was deemed a nationalist, a rightist, a capitalist, or anybody in the black classes was thrown out, executed, tortured, spied on. Their freedoms were limited. And you're seeing the same kind of culture manifest in one of the most prestigious schools of medicine in the country, UNC Medical School. Now, let me tell you that even though they're trying to root out an unspoken curriculum, their methods of rooting out the unspoken curriculum are very much spoken. Let's put it that way. They're very much evident. DEI is in the incentive structure of UNC faculty. My investigation found that even though 85% of your base pay in the UNC School of Medicine is guaranteed, up to 15% is a bonus that is given to you once you have contributed to the quote-unquote organizational goals of the university. What are the organizational goals of the university? Frick, guys, it's the DEI task force. They literally said we need to make anti-racism a priority at UNC, an organizational goal in UNC. That means that they could threaten up to 15% of your bonus for not following DEI protocol or for not being insufficiently DEI supportive. Now, 15%, guys, is a gross understatement because remember that these people are also in charge of your tenure and promotion appointments. So if they don't like you, they might even have the power to limit your salary raises further up the ladder or limit your ability to get promoted or get ahead. I talked with a doctor at UNC who tells me rather frankly that when they were searching for candidates in which he was the only qualified person, because he was a white male, they went out and tried to actively recruit someone who was a minority, even though he was literally the only qualified candidate that they had for this job. They went out and they tried to recruit a minority. That's what DEI does. Forget promoting internally. Forget promoting based on experience. Forget promoting based on merit. We're going to go out and find an ethnic to replace you. No matter how good this ethnic is, no matter how good he is at administering your job, it's in the incentive structure of UNC, guys. Let's go to recommendation 115 of the UNC task force. Examine barriers to recruiting and maintaining an admissions committee that mirrors North Carolina's demographics. Okay, what does this sound like? It sounds like affirmative action. Yeah, affirmative action. If you go back to season 1 of the Inconvenient Minority podcast, you see I talk a lot about affirmative action. This podcast, as I've told you about in the intro, is focused on education and what truly drives people to get better, to not self-victimize, to be better. But we need to talk about it. The elephant in the room. Why do they want to maintain an admissions committee that mirrors North Carolina's demographics? Who cares? Shouldn't it be about experience? No, it's about race. Race is now the primary way that you get ahead in liberal schools like the UNC School of Medicine. They directly propose that the admissions department should be recruited not by merit but by demographic. It's the same language that you see, by the way, in Harvard in their case. At the time of this recording, they haven't yet resolved the case, but Harvard's argument in the case against the discrimination against Asians was that they want to find a student body that mirrors the demographics of the nation. And so what are the demographics of the nation? Well, it's 6% Asian. So I guess that means Harvard should be 6% Asian. Forget the fact that it's currently 25% Asian. They should go down to a third of what it is. All right, let's go to another recommendation here. because and the reason why I'm going down these recommendations is because you need to see how these recommendations are put into practice. These are not theoretical. These are based on conversations that I've had with people at UNC School of Medicine about what the policies that are being implemented there. Recommendation 2.1 says, develop workshops by content experts on how to incorporate outline core concepts of anti-racism with a plan for ongoing use. And recommendation 2.2 says, begin to examine and change content as needed to include anti-racist concepts. These are two things that are still going on at the UNC School of Medicine at the time of this recording, which is June 16th. Number one, the workshops by content experts, those are unconscious bias trainings. So some of you may have in your corporate sphere undergone unconscious bias training. You know, the thing where they teach you how to not be racist. Now, who puts on these trainings? Well, at UNC, it's this group called the Racial Equity Institute. The Racial Equity Institute, and there's a few other organizations out there, they're totally hell-bent on critical race theory, guys. They freaking hate white people, all right? They hate white people. They claim that black people cannot be racist against white people because black people are the marginalized population. You know? They're the ones who have been doing these horrible racial equity trainings on doctors. And one UNC doctor told me he had to sit through 2 hours of this, and it is required of senior staff to undergo these trainings. Also, if you miss a training and you provide some excuse and somebody finds out about it enough, they can cut your pay. Again, back to DEIs and the incentive structure of the UNC staff. So yeah, these horrible workshops you have to listen to, these struggle sessions that you have to listen to is put into the incentive package of the UNC School of Medicine. Recommendation 2.2, begin to examine and change content as needed to include anti-racist concepts. What does that mean? That is, we need to put critical race theory in the health curriculum, and guess what? They already have done that. There's a class called OMED, OMED 420 or 404, I believe, that talks about health and human disparities. And they talk about why black women have a higher mortality rate than white women, which is true. They have a 3 times higher mortality rate than white women. Can any of you guys speculate on why black women have a higher mortality rate than white women? Is it because they have higher preterm pregnancies? Is it because they have higher adverse situations? Is it because they are more obese? Wrong. According to this class, it's because doctors are racist against black women. This was the subject of a study released in 2021, widely covered by CNN, that attempted to paint the medical system as racist by saying that black patients are more likely to receive worse care under white doctors than black doctors. But I went back and I saw this study. I looked at the study, and it is horrible. This study is horrible, guys. What they did is they claimed that you were treated by a black doctor or a white doctor by looking at the image of the presiding doctor at the hospital, not by actually interviewing the patient, by looking at the image of the presiding doctor. Now, as you know, anybody in the hospital sphere knows that when you're delivering a baby, you're touched by like 12 different doctors. So why are you using the doctor whose image is the presiding doctor? That could have been anyone. He may have had a 12th to do with your actual situation. This is called a bad study. It should not be used. It should be taken out. But they decide that they want to integrate this study into the CRT language because it supports the narrative that the medical system is racist, and it supports the idea of the quote-unquote structural causes of health disparities. So this means that instead of learning, and students are actually learning this class in the medical school. So instead of learning, how to actually be a good doctor, how to treat a kidney, how to treat a heart, how to communicate with a patient about their issues, we're learning about how to fight racism in medicine. Wow, great job, guys. That's really going to make me want to trust my doctor. Because the truth is, racism is not a root cause of why Black Americans are more unhealthy than white Americans. It is not. Okay? Your health has far more to do with your own personal behavior, your family, your genetics, your education level, and your trust of the healthcare system. And let's face it, guys, according to statistics, Black people have a very low trust in the healthcare system. So, of course, they're not going to want to get treated by the doctor. They let their problems accumulate, and then they form a disproportionate number of the people who need to be treated emergency-style fashion instead of preventively. 5% of Americans take up 95% of the healthcare attention in our country. And those people are disproportionately Black Americans. Now, to me, that doesn't sound like a racist healthcare system. That sounds like a healthcare system that is trying to treat people based on their condition no matter what. What they could have said is screw you. If they were actually a racist healthcare system, here's what they would have done. They would have looked at this patient. They would have said, screw you. You didn't behave early on in your life. You made poor choices early on in your life. We're not going to treat you because that's putting a lot of attention on you when we could be treating 5 other people who've made better choices in life. That would be a different approach. And, that would actually be an approach that I'm not saying should be considered because it just sounds bad, but think about it. A hospital, if they have to treat one person severely in need, they are ignoring like 5 or 6 people who are a little bit in need, right? So that's like a philosophical question, but ultimately hospitals in America have chosen to focus the most attention on the people in the most need, and that is their prerogative. At the very least, don't call the hospital system racist, please. So, I've talked a lot about this report and how it's being implemented, the core education training sessions, and this is the reason why my organization, Color Us United, decided to tackle the UNC School of Medicine. Because people need to know. The public deserves to hear about what's going on in medicine. They deserve to hear that medical students, the standards are being lowered greatly to accommodate DEI missions that are antithetical to the idea of good medicine. Furthermore, the average American does not care what race their doctor is. They only care that he is the most competent doctor that they can find. So why is the School of Medicine responsible for treating North Carolinians and ensuring their health? North Carolina is a fairly unhealthy state. We're still like half redneck, guys. Not all of us have access to great health care. So the best way that North Carolinians can ensure the best quality healthcare is to produce the best quality doctor. And none of these things help to produce the best quality doctor. Unconscious bias training, CRT in the curricula, DEI incentives rather than incentives for performance and results. This is cultural revolution thinking. It's going to get us nowhere. It's going to make North Carolinians' health worse. Now, in part 2 of this podcast series, I will be talking about how my organization, Color Us United, fought to actually beat UNC's DEI programs and successfully challenge and repeal some of them. I'll be joined by a guest, UNC surgical resident Nancy Anderson, who has a lot of light and facts to share about it. And I encourage you to tune into that podcast next time. I'm your host, Kenny Hsu. Thank you for listening to the Inconvenient Minority Podcast, Season 2.